You know, we don't usually associate strokes with younger people, but there are more and more studies that are showing that more strokes are happening in younger people. It's been going on for years, but maybe there's been a rise in this. Dr. Douglas Barrett is a neurologist with the Lovelace Medical Group. He's here to talk about this, explain why, talk about some of the symptoms. Dr. Barrett, good morning. Thanks for coming in.
Thank you.
Okay, let's talk about this. A stroke. For people who don't know, what is a stroke? How does it differ, say, than a heart attack, which I think a lot of people confuse?
A stroke is a brain attack. A stroke is an event in which there's been a deprivation of blood flow to the brain, and as a result of that, someone will then develop some set of symptoms. The classic symptoms are a loss of strength on one side of the body, loss of speech, a loss of visual abilities, but sometimes people can have very subtle symptoms such as dizziness alone as the major manifestation of the stroke.
You talk about this issue like some weird feeling or a lack of feeling on one side of the body. I hear a lot of times it's on the left side. Is that specifically true, or does it not really matter?
It could be on either side.
Okay. And then, so what causes this kind of lack of blood flow to the brain then, which is the stroke?
There are a number of things. Sometimes the lack of blood flow can come from a blood clot that's come from the heart. It can come from a stoppage of blood flow through the artery, or it can come from a hemorrhage into the brain.
Okay, and usually we associate this with older people. My father's had a couple of them. But there's also this issue of it happening in younger people. Why is that?
There's a rise in obesity in children. I think that's been fairly well documented in the literature and in the lay press. And with that comes high blood pressure, diabetes, high cholesterol. These are the risk factors for strokes that are normally associated with older individuals that we're now seeing in our children and adolescents.
Okay, so I'm going to, I don't want to say play a little game, but get to some issues, talk about what is fact or what is myth when it comes to this issue of strokes, and maybe particularly in young people, but I think it goes for everybody. So the question of high blood pressure, and you kind of just touched on it, is it a factor in strokes? And I think from what you just said, the answer is true. It is. If you have high blood pressure, you're at a greater risk for having a stroke. Is that correct?
Absolutely true. It's probably one of the easiest to control and highest risk factors for strokes across the board.
Okay, so what do you, people come to you and they see this, do you recommend medicine? Do you recommend diet and exercise? How do you get that under control?
All of those things are important. Diet is important to bring down your blood sugar and your cholesterol. Exercise is important for your cardiovascular health, and that alone can sometimes control the blood pressure, but failing that, the use of a blood pressure medication is very important.
Okay, good information. Second question here. This is a good one. Birth control pills are a major factor for strokes in young adults. Particularly this would be women. True or myth? You know, geez, I have no idea. I don't even want to guess on this one. I feel like it's a double-edged sword. So what's the answer?
Well, the answer is that birth control pills put women at a higher risk of strokes than they would be otherwise. The estrogen in birth control pills increases the coagulation of the blood. It changes the basic elements of how blood cells stick together, and as a result of that may result in blood clots. This is especially true if women have other risk factors such as smoking, high blood pressure, or obesity.
So obviously, if this is pertaining to you, you probably got to talk to your doctor to see is it best to go off the birth control or find another method that works for you.
That's correct.
Okay, third question here. Migraine is a cause of stroke in young adults. Why not? We'll go true. Doc?
That's true in a number of cases. People who have migraines have two types of migraines. One is migraine with aura, in which you see colors or lights before your eyes. Another is migraine, best called common migraine.
Okay.
The migraine with aura has been shown to have an increased risk of stroke associated with this. And the reason for that is not entirely clear. Okay. But it's important to identify that as a risk factor, so when people have migraines with auras, they very carefully control their blood pressure, their cholesterol, and don't smoke.
Okay, good information again. And finally, you talked about smoking. So I think the way we're going to phrase this is smoking is not a risk factor for strokes in adolescents. That's a myth. It's got to be, because smoking definitely is a risk factor, right?
It's a risk factor across the board in everyone, and I think that people may think that if you're young that you're not at a risk for having strokes, but if you smoke, it increases your risk.
Without a doubt. I mean,
Without
it
a
increases
doubt.
your risk. It seems like every study that's out there says smoking, every way you cut it, is horrible for you, and it's one of the easiest things to do to make yourself healthier.
That's right.
Okay, you want to find out more about strokes and Lovelace Medical Group, you can head to our website at KASA.com. Click on the KASA blog. Everything is right there. Dr. Barrett, thanks for coming in. Great information this morning. Affects a lot of people.